We want to talk about some of the medical aspects of some of these seasonal illnesses now with Dr. Peter Chin Hong. He's an infectious disease specialist at UC San Francisco. And Doctor, good to see you again. You just watched that really tough story to get through about RSV and its particular threat to very, very young children. And then you hear the term Tri-demic. Is that a little overblown? What's going on here?
Well, I think, Andrew, there's some places that are feeling it much more than others, and that's really in pediatric hospitals. And that's because they don't have a lot of capacity in general. So it's driven really by RSV right now in the pediatric hospitals. For example, at UCSF Pediatric Hospital in San Francisco, there's more than 99% occupancy now and more than 97% occupancy in the ICUs. In the adult hospitals, it's similar in terms of above 90%, but we're opening up older units, getting more people in, so there's more wiggle room. So right now we're seeing a lot of disease being driven by RSV, but influenza is coming up right now. We're seeing influenza levels close to where they normally are in the end of December, early January, so it's earlier. And COVID is, the dark horse is coming up slowly behind those two. At UCSF, we went from about 10 cases of COVID a day. Now we're about, 40 or so. So again, nothing close to 150 like in January, but nevertheless contributing to, like you put it, that Tri-demic.
So some of the, literature I've been reading, speaking with some other people too, they don't think it's going to be, for COVID at least, like we saw last year with the Omicron variant. They don't think it's going to be nearly as bad.
Correct. I don't think it'll even be close to where we were in the last 2 years, but it's still going to add a little bit of strain. Even if somebody isn't coming in with COVID or because of COVID disease, because they're COVID positive, we have to isolate them. It takes more room. It takes more resources. But I agree with you. We're not even going to see, in terms of COVID deaths, what we saw in the last 2 years. But again, we didn't have RSV and flu at the same time last year either.
Doctor, there's a shortage of some of this, over-the-counter cold and flu medicine that you don't really need a prescription for. I want to hear from our Fox 2 Bay Area reporters about that, and then we can talk to you about it in the meantime.
Sounds great.
It was scary because I don't like getting sick a lot.
For weeks, some sick kids have had to suffer because of this.
Empty shelves. Hard to find a lot of stuff.
Low stock or no stock on pharmacy shelves. The missing items, children's Tylenol, Motrin, and cough medicine.
I went to 2 CVS's and then finally found some at Safeway.
This East Bay family traveled from Concord to Walnut Creek just to get what they needed.
It was a challenge. Yeah, so we kind of resorted to like cough drops for kids versus medicine.
Even pharmacists say an increased demand for fever-reducing medicines like ibuprofen and acetaminophen is scarce across California and the nation.
There's been a huge shortage. I'd say for the last 2.5, 3 weeks, it's been out. Every wholesaler we can think of to try to contact to get inventory has been basically, there's no allocations. There's nothing available.
Pharmacist Ken Tai says his pharmacy is lucky to get a couple of bottles or boxes a day.
It's super tough because we're dealing with kids, and as a parent myself, it's very difficult to tell a parent that you don't have medications which they truly need.
Manufacturer Johnson & Johnson says we're experiencing high consumer demand and are doing everything we can to make sure people have access to the products they need. We will continue to work with our retailers to provide children's Tylenol throughout the cold and flu season. The FDA says it is not reporting shortages of the drug, but like the manufacturer said, there is an unusually high demand.
I do think this year is different. We're dealing with the so-called Tri-demic of COVID plus RSV plus flu.
Doctors say symptoms can typically be treated with alternatives or modifying other versions of medications.
There's also the possibility of talking with the pharmacist about dosing of the adult version of those medications and potentially being able to grind that up and put it into a liquid or into something like applesauce.
Best advice, don't panic. Doctors say most symptoms this season are relatively mild, so have kids drink plenty of fluids to let the virus run its course, just like this guy did.
I like to go out places. That's why I don't like to get sick.
Okay, doctor, so I guess my question is, what came first? The shortage of this or the rise in cases like RSV and flu, do you think?
It's definitely the rise in cases. What's happening when people are just sick? So it's actually 4 things, not just 3. I mean, we focus on flu and COVID and RSV, but the common cold is also very common right now, particularly something called rhinovirus, which is the most common cause of the common cold. So you have all of these illnesses going around, parents bringing their kids to the doctors. There's a shortage of amoxicillin now, the antibiotic, because many of these can cause air infections, even though it's not a bacteria a lot of times. And then there's a shortage of over-the-counter medicines because a lot of symptoms, we're trying to relieve them in ourselves and in our kids. So this is kind of a real issue of so many viruses floating around right now.
Okay, any alleviating factors here, or is it just kind of a waiting game, you think?
No, I think there are a lot of things we can do for symptoms that are outside the drugstore. I think humidification is a really important thing that can help relieve symptoms. Even running the steam, the hot shower hot, and just using that steam for these tiny airways that can be alleviating. Honey for sore throats. I think some of these remedies are coming back, and like the announcer said, or the reporter with the interviewee, having pharmacists maybe think about what they call compounding, or taking a bigger dose and cutting up a small amount and putting it in applesauce or something like that could be an option like parents can use. But I agree that we shouldn't panic. Most of these things are not causing fevers per se. Hydration is just from chicken soup or fluids or Gatorade or just water. That's really important to continue remembering.
All right, as always, really great information there. Dr. Peter Chin Hong, we always appreciate your time. We'll talk again.
Thanks so much, Andrew.